Welcome to our webinar this evening. My name is Mary Christa Smith, and I'm the Executive Director with Communities That Care, and we are a local coalition of nonprofits and concerned parents and youth-serving organizations in Summit County and Park City, Utah, who are dedicated to supporting the mental health and wellness of our young people and families. And I'm really delighted to be on this webinar with Dr. Brad Reedy. And he joined us last year during Mental Health Awareness Month and a number of other times. And we're so glad to have him back virtually during this time of COVID, because we are meeting virtually now instead of face-to-face and in person. And I'm really glad that Brad is here to talk about a topic that I hear continuously from our community, from both kids and parents, about the grief, the loss, and the anxiety that we are all experiencing during this time of COVID, this unknown time, this time of, great change and loss of rituals and routines and certainty in ways that is really rocking people's world. So I'm very happy to have Brad here to share some of his wisdom and to open up the space where we can ask questions and be together and find some support and useful tips and tools that we can carry with us forward. So without further ado and with deep gratitude, I turn this over to Dr. Brad Reedy.
Thanks, Mary Christa. The first thing to acknowledge is that tonight was supposed to be a night where I was going to be in Park City talking about my new book on my book tour. And so, even the very idea of this evening and this broadcast signals a kind of a loss for me, for everybody, and for so many of us. There are so many things that we didn't recognize in our lives that we took for granted. I was just taking a picture of a chair in my room yesterday in my office that I'm spending so much time in lately as I work from home. And my wife was commenting on the fact that I see you're starting to see beauty in areas that you didn't see. So I want to acknowledge first and foremost that it is a time of collective grief. It's a rare time in our lives and in my history where we're all sharing a very similar grief. But here's the tricky thing about grief. When two people in a family even share the same specific objective loss, no two griefs are the same. And so the first thing we learn when we go to school and learn about grief counseling is that families often need an outside person to come in, because while two people are negotiating the same, perhaps person, or in this case, the same collective loss, no two people are quite going through the same process themselves. So it's hard to be there for each other in ways. So what that does for me is it invites a deep self-compassion, the need for a deep self-compassion, to be able to look at our struggles and our adjustment to this with patience. I've talked about this before, that if you didn't have a mental health practice, a spiritual practice before this, then it's going to be especially challenging, because things are different today. Things are challenging today. There is this literal threat out there to our safety, and you can't fix it. There's nothing you can do about it. Nothing you can do about it on a grand scale or a macro scale or a global scale. You can social distance, you can wash your hands, you can be careful with your own stay-at-home practice, but there's not a lot that you can do to ultimately change the circumstances outside of you. And so I think that COVID is like life, only with the volume turned up. I think the thing that it asks of us, life asks of us every day, but right now there's just no escape. There's no distraction. I was sharing with somebody earlier on in my COVID, in the stay-at-home practice, stay-at-home order. I was sharing with other people. I was saying, I remember going on errands to the bank or to the store. And I wondered, those kind of broke up my day. I remember being on an airplane for 3 hours when I had to travel. And that was a time when I wasn't accessible to anybody else. And I looked at that as kind of my own time, my quiet time. And so all of these little things have been taken away from us. Here's the thing about trauma. I think a lot of us think of trauma in ways that most therapists think of big T trauma. I think that comes from our childhood, right? I think many of us, when we experience some kind of small trauma, or what therapists will call small T, that we were told that our reaction was too much, that we were overreacting, that we were being too sensitive or too dramatic. And so we have kind of wired into us this idea that we shouldn't really be suffering, and in times and places when we are suffering. My favorite definition of trauma is anything less than ideal. And under that definition, we just get the permission to feel what we feel. I read something on social media a few years ago that I thought was both funny and insightful. And the quote went something like this. It said, telling somebody that they shouldn't feel bad or sad because other people have it worse is like telling somebody they shouldn't be grateful because other people have it better. And the kind of psychology that I teach with families, you get to feel what you feel. You get to feel whatever it is. You get to be a self. That's the work. You get to be a human being and a self. You know, transitions even can be thought of as trauma. Even though the transition to a new place, a lot of people are going through graduations. I have 2 children going through graduations, one from graduate school this semester and one from high school. And in both cases, as many of you will attest to in your own families, they put in a significant amount of work and sacrifice. And I was looking forward to celebrating with them in the traditional ways that we celebrate those kinds of transitions and achievements. But of course, in both cases, we're finding some alternative way to celebrate it, some virtual way to celebrate it. But that can be a stressor, that can be a loss. But of course, out of this process, we can still find ways that we, as we are tonight, to connect. And it is in our connection that we can find healing. Pain is inevitable, the Buddhists will tell you, but suffering is not. And the way to turn our pain into something less than suffering is through connection, to not do it alone. I've told this story many times that when I was diagnosed with multiple sclerosis about 4 years ago, I was on the way home from the hospital, shocked with the diagnosis. I'd been at the hospital with my wife. She was we had driven to the hospital in separate cars, and I ended up calling my son's friend, who was about 25 at the time. I did it because I knew that his father had multiple sclerosis, and I knew that his brother had multiple sclerosis. I didn't know what I wanted. I didn't know what to say. I just know I didn't want to be alone in it. And I called him and I said, Tyler, and without being able to get the words out, I broke down in tears while I was driving. And I said, I just got diagnosed with multiple sclerosis. And Tyler said, without skipping a beat, he said, Brad, I love you. You're not alone, and you never will be in this. And I had no idea that that's what I needed, and that's what I was looking for, but it immediately gave me some sense of comfort. So it is through our connections, which can be challenged at the time of COVID, it is through our connections that we find some sort of solace in our collective grief. Like I said, no 2 people have the same loss, and therefore no 2 people cope with that loss in their own way. You're seeing lots of things in the news and on social media about ways to cope and tools and skills and activities to use. The fact of the matter is, whatever it is that you need to do to be able to cope with this that can give you comfort is okay. And sometimes that's going to be in a really enlightened, really psychologically advanced way, and sometimes it's going to be a cheeseburger. But in all, the practice of self-compassion, it's not really the reaction to the trauma that often becomes the biggest problem. It is our reaction to the reaction, our judgment about the reaction, that becomes the bigger problem. I was talking to, we run online intensives for folks. We were planning on doing in-person intensives, as we usually do during the summertime, but we ended up moving these online. And in moving these online, I was talking to a group of folks this weekend, and one of my therapists offered to one of the participants, they were beating themselves up about their triggered reaction to their child. And the therapist said to this woman, it's not your reaction, but it's your judgment of the reaction that can be the real problem. We might have limited resources to provide for others. And so if your children are in need, if they're in pain and they're suffering their loss, you might need outside resources like this. If you've come here tonight, I want to commend you, because this is a place where you're going to listen to ask questions, and to connect. I always try to encourage and praise people for showing up in a therapeutic setting, whether it's on a webinar that we have for parent support or alumni support of our intensives, or whether it's a webinar. You're doing something to take care of you. And ultimately, we learn to move through these feelings. Addiction or self-medicating, or even our smartphones, the overuse of smartphones or technology, are really just attempts to not be present in our life, aren't they? You know, I have this comedian that I love, and he talks about pulling up to a stoplight and not even tolerating the 5 to 15 seconds at a stoplight. So he goes and checks his phone, and maybe even reaches out and texts somebody. How many of us can relate to that? So learning to sit through it, learning to find people who can sit with us. I said something to my therapist last year. Between 2010 to 2012 was a really difficult, dark time for me. I was separated from my wife. I was confused about what I wanted and where we were going, and my direction in life. It was very painful, very anxious, very depressed time. And my therapist that I've had now for 21 years, at the time, she said to me, she just sat with me. She didn't get impatient. She wasn't anxious and in a hurry for me to figure it out, to find a solution. She just sat with me week after week, sometimes twice a week, with seemingly infinite patience. And I said to her just last year, I said, Jamie, as I was finishing up my most recent book, and kind of just putting the finishing touches on it, I said, Jamie, I realized something. Because you sat with me, really, really sat with me, I learned to sit with myself. I don't know how to do this alone. And at a time when all of us are taxed, when parents are feeling losses and children are feeling losses at the same time, and sometimes the loss is the same event or situation or circumstance, we need to find other sources of support. And luckily, we have these mediums, these virtual opportunities to find other sources of support. We have a podcast called Finding You, an Evoke Therapy podcast that I broadcast once a week. We have 340 episodes. A good book, other podcasts, those can all be sources. You know, when I know when I'm training my staff and we have a group circumstance, we have a wilderness therapy program. Evoke Therapy programs principally is a wilderness therapy program for adolescents and young adults. They basically go camping for about 2 months and they get therapy, mindfulness therapy, primitive living, group living. Even NASA uses primitive group living with their new teams to help build trust. But our wilderness therapy program, whenever there's a very difficult dynamic or circumstance in the group, I'll often say to my staff, just keep them safe. Don't worry about the small brushstrokes of the group this week. Don't worry about some subtle principle that you want to teach the group or some group topic that you want to introduce to them. Just keep them safe. You haven't lost your ideals. You haven't compromised anything, but be kind to yourself. And as the clinical director, as the treatment team leader in those circumstances, the staff will tell me over and over again, thank you for the permission. Thank you for taking that off of my shoulder. Maybe I put it there myself, but thank you for taking it off. So this is your official doctor's note to give yourself a break. And the fact of the matter, I talk about this with this threat. You know, I work with young people that suffer from addiction and mental illness issues. And I talk about this idea that the way that the world feels to us right now is the way that it feels to them every day. And if you already have anxiety or other mental illness issues or addictions, it's going to be amplified during a time like this. So if you have somebody in your life who struggles with anxiety, depression, any other mental illness or addiction, if nothing else, you have a sense of what the world feels like to them on a day-to-day basis. And so we have to learn to feel. We have to learn to go through our fear, to sit with it. My therapist said to my wife and I recently, we had our first couple session in many years, and we were navigating something difficult just prior to COVID with one of our children who was our last child of 4 to enter the teenage phase of life. And we were having an old discussion and an old difficulty, so we had a couple session. And our therapist offered this idea, like sometimes you just have to sit with the fear. If you can sit with somebody else or if somebody else can sit with you in it, all the better. But sometimes you have to feel it. It's like that quote at the end of, and I'm not going to get it correct. It's like the quote at the end of Jojo Rabbit, if you saw the movie, by Rilke, about how to learn through beauty and terror, to learn to let it pass through you. No feeling is final. We learn to feel. That's really what therapy is. It's learning to feel. That's why the essence of therapy is showing up and telling the truth and talking about how you feel to a welcoming, empathic other. You know, fear and anxiety are contagious. And so I've talked about this since the onset of COVID. I think we have to be more intentional than ever. And I think this is a good practice in non-COVID life, but especially during COVID, we have to be intentional about our intake of news and social media, and find safe places to feel. Find others that can listen and sit with you the way that I described that my therapist could sit with me. I love this quote by Ram Dass. It's this idea that if you think you're enlightened, spend a week with your family. Ram Dass, the guru, passed away last fall before COVID hit. And I think if he were alive today, he would say it more passionately. If you think you're enlightened, spend a week with your family in quarantine. And what he's saying is give yourself a break. You know, don't hold yourself to an unreasonable standard. I'm convinced more and more and more. I'm convinced that the key to mental health is self-compassion. I read a quote the other day that says, you've tried beating yourself up over your faults and your fallibilities. How about trying compassion and seeing how that works? I've talked about this idea as we entered COVID, that I talk about this with parents when they have a child that's struggling. Even if it was working for you before COVID, it might not be working now. You might not have needed meditation before COVID. You might not have needed a support group. You might not have needed to listen to podcasts on self-help or mindfulness or meditation, or to read a book on those topics. And it might have been just fine for you before then. But when you're given more stressors, more trauma to juggle, to navigate, your old way might not be enough. We have to adjust. What's working before may not work now. When our nervous system is upregulated, right? That's what happens in times of stress and trauma. When our nervous system is upregulated, we have two general choices. One is we burn off the energy, right? In times of stress, if a car is about to run into you, you have a rush of adrenaline, you're able to jump out of the way, right? Run from the wolves, fight or flight. But with COVID, with this threat, there's nothing to do except for, ironically, stay home, social distance, wash your hands, right? Practice in those areas. So you have two choices. You can lower through meditation and mindfulness your nervous system, or exercise. Right? Become active. Those are essentially your two choices, because this is the worst part of it. Introducing moderate levels of stress to the system, which comes in the form of cortisol, the hormone cortisol, it does something that we don't want to have happen right now. It compromises your immune system. So we have to find ways through mindfulness, meditation, some kind of practice. Therapy can do it. I think of therapy, so often I'm talking to a client, and at the beginning of this session, they're upregulated, they're agitated. And somewhere in the middle, toward the end of the session, just by holding space for them, I see them relax. And I'll comment on it. Often I'll say, you seem more relaxed than when we began. I want you to notice this. I'm trying to reinforce the practice of expressing themselves and laying their burden in a place where it can be welcomed. It's dangerous. Some of our self-medicators can become very tempted because drinking and drugs are fantastic. They're fantastic at downregulating our nervous system. The problem is the long-term consequences are devastating, and we develop a tolerance. Our brain stops producing the chemicals that provide comfort for us, and so we need more and more over time. Like I talked about, be intentional of your consumption of news and social media, and be careful about your exposure. There was a question that I had last night from a client when I was doing a podcast about a son coming home from college and having to live with them right now. And we were talking about taking time, taking space. At one point, the client came up with an alternative. They have 2 houses, and they talked about this adult son living at the other house because the contact was so triggering for everybody. So in their case, they found a solution. I talk to clients all the time who think I'm supposed to be able to manage myself, and I point out to them, you're in situations that are overwhelming. If you can't set a boundary, if you can't exercise a boundary, then I don't know anybody that can manage. I don't know if I can manage it in your situation, and I might have more experience in that area. Recognize regression and primitive coping. I love this story from Ben Lerner. He won all kinds of awards with his new book, The Topeka School. This year. He's a great writer. His mother, Harriet Lerner, is a great self-help author, one of my favorites, and a friend of mine. And in her book, Dance of Connection, she describes an incident where Ben is coming home from his sophomore year of college. And as he's coming home from the airport with his father, he says to his father on the way home, he said, Dad, I can feel the layers of maturity peeling off of myself the closer and closer I get to home. Part of maturity is not just being able to grin and bear it or tolerate things. Part of maturity is making decisions to change your environment and to recognize triggers and to make adjustments. And of course, be kind to yourself. No matter the difficulty, it's imperative that we develop a practice and a position of self-love. Failure to do so will create the pain and turn it into unnecessary suffering, like I said. I like therapy. That's my favorite. I haven't found a good substitute for what I describe as sitting in a room with an empathic other. Sometimes it's a virtual room, like right now. Sitting in a room with an empathic other and re-experiencing myself. When you sit with an empathic other, an empathic person who can listen, who's not eager to fix, who's not eager to solve things, who's not eager to problem solve, who doesn't need to be a good therapist. They've sorted that out themselves, so you don't need to get better. When you sit with that kind of a person for a while, you start to re-experience or re-internalize a different sense of yourself as being okay. So therapy is kind of a reparenting. Our struggles, our missteps, our reactions caused our parents all kinds of distress. And because of that distress, we internalize that something is wrong with us. So therapy is a reparenting experience, a reattachment experience. Meditation, like I said, can be very helpful. Group support, finding groups. Al-Anon, National Alliance on Mental Illness, CODA. There are virtual support groups online all over the place. Exercise, like I described. And be careful of solutions that become part of the problem. Taking time outs, like I said, learning to sit with yourself. Dr. Lerner talks about in The Dance of Fear, our relationship that we have with fear. I want to talk about this aspect from a parenting because a lot of us are holding space for our children. I love this quote from my very favorite book on child development in the world ever, the Drama of the Gifted Child by Alice Miller. She says, "For a mother can react empathically only to the extent that she has become free of her own childhood. If she denies the vicissitudes of her early life, she wears invisible chains. What the mother had once failed to find in her own mother, she was able to find in her child. Someone at her disposal who could be used as an echo and could be controlled, who was completely centered on her, would never desert her, and offered her full attention and admiration." We have to do the work as parents. If we don't, we're going to look to our children to meet our needs. We're going to need them to show up a certain way with a certain feeling. And we're going to replicate the cycle from our own childhood. So we can't be present for other people, children or other, unless we develop this empathy, unless we experience this empathy from somebody else. I read this quote last year. I love it. I think of it all the time when I'm talking to clients. The first thing you should know about me is that I am not you. A lot more will make sense out of that after that. You know, part of my work, my new book is called The Audacity to Be You, Learning to Love Your Horrible, Rotten Self. One of my early titles was going to be What It Means to Be Human in Love and Other. In some ways, I think mental health and families and relationships can be the ability we have to provide and allow for others to be themselves. Can we still remain connected to them and allow them to be ourselves? Folks, I want to be as emphatic as I can about this. I don't think that is a common practice or ability. I really don't. It's so hard for us, even in this time of this unknown time of grief and loss. There's so much that's not known, which is, by the way, is its own loss. Not knowing is a loss. We had plans. My son is planning on going to school in the fall in New York City, just outside of the city this fall. We don't know if that's going to happen. And if he gets there, we don't know if there's going to be a second wave of the COVID-19 virus, and he's either going to get stuck or he's going to have to leave in a moment's notice. So much is unknown. So part of our job is to provide space for each other to deal with life, to be ourselves. With our children, listen. I was recently running a group intensive like I described earlier. This was right before COVID. And I said to the participants, I said, try not to be helpful to each other. Try not to be helpful. And while that might sound silly, I said it for a specific reason because I could tell a lot of their group interactions were coming from a place where they thought they were being helpful, but over and over and over again, it was shutting down the feeling of the other person. And when I said try not to be helpful, one of the participants broke down and said, that's my big wound. I lack the ability to sit with somebody in their suffering and just be with them. You know, when I became a therapist, I thought my job was to make people happy. I really did. My mother told me I could do it, so I believed her. Some of my friends told me I could do it. So then I went ahead and got a degree and got licensed to embark on that journey. But what I realized after a very short period of time, I remember I was working with a young boy who lost his mother, and I realized I don't think it's my job to make him feel happy. I think it's my job to help him to feel everything. And so when you think about what you can do for the people that you love, it is to develop the capacity. It's really a capacity, folks. It's really a capacity to provide a space for them to feel everything and to resist the impulse to be helpful in the short term. I was talking about this with Mary Christa yesterday, or maybe this was on when I was on the radio with her this morning. Ask questions of your children. You don't have to have the answers. I think I did a podcast 2 weeks ago on shifting the idea about what it means to be a good parent on our Finding You podcast. And one of the principal ideas is we think we have to have all the answers, the solutions, the lectures, the skills, the tools, and all, of course, all those can be helpful. That wisdom can be helpful. But most importantly, we need to listen, ask questions. Like I said, I have a senior in high school and I have a son graduating from graduate school right now. And I've had to ask them more than one time how they're feeling, and their feelings have changed. I was doing supervision with a therapist earlier this week, and she was talking about a real dilemma with one of her clients. And she said, I just don't know what to do. I felt the pull, right? I felt the pull on me, like I'm getting that urge to pull a rabbit out of a hat. And then I remembered all of my work with my therapist, and I said to my friend, my therapist friend, I said, I think it's good that you don't know the answer. Tell your client that. Tell them that you don't know how to fix this. In fact, an easy fix could be pretty disheartening to a child or to a client. They probably will feel a little bit less alone. And some things aren't fixable. An alcoholic spouse, a child struggling with mental illness, COVID. Some things aren't fixable. So we learn to embrace not knowing. And you start to realize that everything that we were taught as children, or many of the things that we were taught as children, don't make sense anymore. A lot of the parents that I work with will say to me, the old conversations that I used to have at dinner parties don't make sense. I think it's important that you learn how to get in touch with your feelings and talk to somebody about it outside of the family. I think I've made that point, but it's important. I know that so far this has been one way, and I'm going to open up in just a few minutes, but part of it is to offer you some company in this and to know that you're not alone. Just like my friend Tyler said to me when I was diagnosed, you're not alone. Let me get to some questions and just kind of give you some resources and open up some questions. We have the Evoke Therapy podcast, evoketherapy.com, drbradreedy.com. We have the intensives. We have a couple of more on the schedule coming up. And then, of course, my two books, The Journey of the Heroic Parent and The Audacity to Be You. So I wanted to open up to be with you and to see what questions you have. I'll bring Mary Christa back on. Or I'll invite her back on. And Malia, you can pass on any questions you might have gathered. Or maybe I'm alone in this. There she is. Welcome. Mary Christa,
We're learning new things here.
you and I have had a couple conversations. What comes up from you? What comes up for you with the things that I'm talking about? What questions have you been grappling with during your complex grief and your loss at this time?
Yeah, from a personal level, and I hear this echoed through the community, and I can relate with it personally, is the loss of the future planning. I'm a big upstream planner. It's how I like to imagine that I have control over things. And with having a daughter who is 18 and her graduation robe came today, and we're planning, one by one to go through the graduation ceremony next week. And there's deep loss over that that's surprising to me. It reduces me to tears when I think about it. And my mind will say that doesn't really make sense and it's going to be okay. But inside, like from a deeper feeling place, I feel this very, very deep sense of loss that I really can't make sense of or put into words. And then I watch my mind say, okay, but she's going to college. And then I have these thoughts like, and what happens if she doesn't? And what happens if they close school next fall and she has to stay here another year? And how are we going to do that as a family? Because we've made it so far, but it's time for the individuation to happen. And this is where my mind goes. And I, it's not really fixable, and it's hard.
Yeah. I've been saying to people that I've never, the phrase, the slogan from 12-step groups, one day at a time. I've never thought it to be more applicable to life than right now. In our wilderness program, we have a saying, no future information. We don't tell the kids what we're doing that day. We just kind of take it minute to minute. There's no clocks. They don't know what time it is. And we do it to invite a kind of presence and mindfulness. I mean, we've done this for 25 years in wilderness therapy. And a lot of the kids have told me, either directly or through their parents during this time, that wilderness therapy prepared them for right now. And they're looking around at their parents who are struggling with this lack of planning and saying, Mom, Dad, the illusion that you've lived under, that you could actually plan something, is something I had to adjust to a long time ago. So it is a loss. It's a removal of a sense of control. My daughter said to me several times today, she's 12 years old. She has her first boyfriend. And she says, Dad, will you look at the death rates right now? And is there a number that you'll be satisfied with where I can hang out with my boyfriend in person? And I just keep having to say to her, it's one day at a time. I don't know. It's a very, very difficult dynamic to be confronted with. And like I said, it's kind of like life. It's kind of like life. Like we have this idea that we can plan and everything's going to go, but COVID has showed us that illusion is pretty thin. Somebody asked a question, Mary Christa, that says how to help a person with OCD to sit with their anxiety of getting infected with COVID-19. I would direct you to NAMI.org, to find, OCD, if you're diagnosed with OCD, there's medication that can help, of course, finding a psychiatrist. Psychotherapy can help, but also finding resources from NAMI, which is free. We have a local chapter that you can access here, that you can find classes, online classes and information. There's other people that I know that treat OCD, but you're going to have to find these resources, right? Therapy, online therapy, virtual therapy, reading. Ultimately, with the help of medication often, you're going to have to sit through it with somebody who can sit with you. And in my world, that's a psychotherapist or a support group, right? That's how I'm able to sit through unbearable experiences. And medication, of course, can take the edge off. So those are some resources that you can reach out to and contact that might give you some more specific therapists that work with. I know a couple in the community, a couple across the country that work specifically in that area. Dr. Katja Moritz in Florida runs a world-renowned clinic for OCD, and they are taking clients right now and doing some stuff virtually. So if you want that information, you can reach out to me at brad@evoketherapy.com, and I'm happy to connect you with her. She actually vacations in Park City during the summer often, so some of you might know her or have run into her. Looks like another question. I live alone. I don't have any family in town, and my children live on the West Coast. I am working on taking care of myself, but secretly wish that my sons would check on me more often. I'm glad that you're talking about it here. I'm glad that you took care of yourself tonight. I think that it makes sense that you want the people that you're close to check in on you. You can ask them. You can reach out to them. Even checking on them, or just, especially with children who might be adult children who might be going through similar stresses, keep the phone calls short. Allow it to be a 2-minute or a 5-minute phone call. Establish that it's not going to become an overwhelming experience for them. Ultimately, finding other sources of support might be needed because they might be overwhelmed. Like I said, you might be sharing a similar kind of grief with them. And so finding other people that can do it. I always think about this in my family, both as a husband and a father, that part of my practice, part of my responsibility is to take care of myself so I can be there for the people that I love, right? If I draw out from them as a father and a husband, and I can at times, but if I draw too much out from them, I'm really adding to their burden. So I have a practice that is outside of my family so that I can come back to the family and offer them love, or offer them some input, offer them some resources, become a resource for them. Do you have any other thoughts about that?
Brad, I don't know if this is therapeutically correct, but what I hear in this question, which is inspiring to me, is inviting me to think about who could I spend some time reaching out to myself. It's bringing up, there are people who probably would really benefit from hearing from me, and in my busy, I maybe haven't taken the time, and so I'm inspired by this question to make the time to reach out and simply connect with people who I know would love to hear from me.
My mother, she's 79, going to be 80 this year, and she lives by herself in Southern California. My son and my sister-in-law drop off groceries for her, and she's been self-quarantining even before it was called for in California. And I was talking to her on Mother's Day and asking her how she's doing and checking in on her, and she said her church had this program and they had a name for it. I don't remember what it was, but for reaching out to people who needed support, and she signed up for it. She signed up to offer support for other people, and she felt connection in the offering of support to other people. And so that's a really wise thing you said, Mary Christa. We oftentimes find connection in the moments that we reach out to other people. So yeah, I think it invites or inspires us to realize that there are people that might need our support, which will, like my mother, will give us something back. Somebody says, what would you recommend for someone struggling with the anxiety and fear involved in the care of their loved one who is a high acuity patient with moderate dementia in a long-term care facility when they will not allow visitors? You know what's interesting about doing these? Just like I said earlier on the broadcast, some of these questions are so powerfully heartbreaking. I don't have an answer for that. That's just a lot. There's no quick fix. There's no 3-step process. Like I said, the idea of getting support, but you listed what I would say to you tonight. I don't know who said that, because I'm just getting the questions passed on from me from Malia, is that I'm glad you're here tonight. I'm glad you're here, and I'm glad you're sharing that with us, and you're not alone for an hour. And if anybody else wants to send this person some love, they can pass that on to Malia, and she can pass that on. But the list of circumstances that you've described, the only thing I know is that you need support, and so that I'm glad that you're here, and I want to give you just a moment of not feeling alone. So I'll invite anybody who wants to send love to you to send it in the chat and to pass it on. Mary Christa, do you have anything to add to that?
Just that my heart is with you, and I wish that there was something that I could say or do that could change it, and I know that there's not. And in my own practice, my own mental health practice, when I come up with against moments like this of deep challenge and sadness and worry, my practice is to make a little altar to that person, for that person, and I tend it. I go and I light a candle, I talk with them, I send them my love, and it feels like it makes a difference, not only for me, but for them as well. So that's my personal practice of how I come to moments like this.
And I'm happy to pass on anybody else's ideas, just because I don't know anything else to offer but my love and companionship. I'm happy if anybody else wants to pass on any of their thoughts or ideas. Maybe people have experience in that area. So thank you, Mary Christa, for sharing your practice. Someone says, my 19-year-old is living outside of the house and refuses to socially distance. We are in New York City. Any suggestions? I'll tell you what I did. I have, because I have MS, I'm on a drug that reduces my immune system, because that's what MS is your immune system attacks your nerves. And so I told my adult daughter and her boyfriend, you can stay here, but you can't come and go. I had to set the boundary for myself. My life will be at risk if I get sick. I'm one of those people who has underlying conditions, and I'm a high risk person. And so I'm grateful that they chose to stay here and didn't choose to leave. And I don't know what it will be, but like I said, somebody I know got a bed and breakfast for their child. In fact, that this person may have also been in New York City, and there are or not a bed and breakfast. I said Airbnb for their child at a pretty affordable rate, and so that was an option for them. Like I said, my other client that I talked about had a second home and offered that, but you get to set a boundary. It's the same as if your child was using crystal meth in your home or physically abusing you. Um, it's not easy. I'm not telling you it's cut and dry, but I'm telling you, you're allowed to take care of yourself. You are. And again, you're probably, if you're going to draw that line, you're probably going to need support from other people. But you're not in a choiceless situation. You're in a very, very difficult situation to make a very difficult choice, but you're allowed. I tell parents this all the time. In fact, that's why, and why the first chapter in my book is about finding yourself. That's the foundation of being in any relationship. It's okay for you to prioritize self-care. Any thoughts, Mary Krista?
I would just echo what you say, Brad, that, the boundary comes from within. And for me, when I'm having a hard time setting a boundary, I practice just closing my eyes and getting really clear on what my yes and my no is. And once I know what is true for me, then I can communicate it and say, it may be crazy, it may not make sense, but this is my boundary and this is what's true for me. And it's made the situations where I've had to do that just much more cut and dry and clear without having to have a big back and forth, because there's no argument with that.
Will you read those two comments? Can you see those? The one that starts with "I am a social worker and please tell the person." These are from a couple of people wanting to offer support to the other person that shared her question or their
Yes, would you
question.
like me to read those two
Yeah.
comments? So the first is, I'm a social worker in a hospital. Please let this person with a parent in a care facility know that social workers at the facility can help with giving you updates, photos, or FaceTime so you don't feel quite so disconnected. Thank you. That's lovely. And the second one, please tell the person with the family member in the LTC that my heart goes out to her. I'm sending virtual hugs, a reminder your loved one is safe and being cared for. I'm wondering if there is a way to see them from a window. I know my good friend has seen her father through a window. Thank you for being there. Hugs.
I don't know if I shared this with you, Mary Krista, and I know we're friends on social media, so you might have seen it, but my father passed away from COVID 3 weeks ago. And I was the last, I believe I was the last person in the family to talk to him virtually. And the nurse held up a FaceTime so that I could say goodbye to my father on a Tuesday night. He passed away on a Wednesday. He only had COVID for 5 days. He refused the ventilator because he had some complications besides this. So I remember there was nothing I could do. And my brothers couldn't visit him, and his partner couldn't visit him. And we were all hopeless, and all we could do was all we could do. And that just reminds me of this comment from this person that the nurse, who didn't even want to be named, spent an entire several hours with us, one after the other, being allowed to say goodbye. Myself, my four brothers, his partner, and my father's siblings. So I'm with you. Sibling rivalry. Somebody says sibling rivalry at my house has reached new heights. How do I diffuse it? Well, that's it. These questions about problem solving are very, very difficult because it's complicated, right? Like it's a combination of many things. It's a combination of you were describing something. I have a thought. Let me shift gears. Here's my thought. Before trying to fix the behavior, maybe try to understand it first. I was going to give some talk about boundaries in the way that you just did, Mary Krista. And then I thought, And then I remembered that the children might be suffering and that they're under stress and experiencing loss. And I was just teaching my therapist at our wilderness therapy program recently, before you get interested in trying to change the child's behavior, consider asking them how they're doing, not just once, but many times. And I said to the therapist, I said, think about how it would be when you are struggling if the authority figure in your life, instead of trying to get you to become less symptomatic, became concerned about what was going on in your inner world. And so if there was a way to practice deep listening with your child, one-on-one ideally, think about kind of suspending initially your instinct to try to fix the quarrels and try to understand what is going on. That can be a pathway to healing. That can be a pathway to shifting it. If not, I don't have anything, really out of the box to talk about besides boundaries. But for me, the more important endeavor is why is there sibling rivalry? Why are they feeling threatened? And ultimately, is this a function just most simply because they're being, what's being added on their shoulders is all the stress and all the loss and all the trauma we've been talking about today. And all of us under duress are going to operate at a more primitive level. And so even offering your children that empathy, that understanding, that knowing at a time like this, all of us can be compromised. That's what comes to mind for me.
We hear that a lot. I hear that a lot from parents and from kids, that the sibling rivalry and the tension is increased in the household. And to your point, Brad, what you had spoken to earlier, which is our old coping strategies may not work in COVID, like my upstream planning doesn't work anymore. And the ways in which families have coped and dealt with sibling rivalry in the past may not be available to them by having time apart and staying really busy or what have you. And so it invites, like you say, just a curiosity and a leaning in and looking at what's really underneath it.
In my first book, The Journey of the Heroic Parent, there's a chapter on behavioral change, which you have to, it's an obligation to include a chapter on behavioral change when you write a parenting book. Otherwise, people will just wonder where it is and why it's not there. So I was forced to by others to include it. But the very first paragraph, I say essentially that. I say, before trying to change a behavior, first try to listen to what the behavior is trying to tell you. And get curious about that and understand what needs are being expressed through that maladaptive coping. So, and I think that can be a practice that can be very, very broadly applied to our children and to each other. I think it's important. Somebody asked this question: our children already suffer from high anxiety much more than we did as children, I believe. This will cause a lot of more anxiety in our children, our schools. As you mentioned, parents want to fix this, but we need time. How does a community learn to do this? I'm gonna expand this a little bit. I've said this to Mary Christa before. I said it last year when I was in Park City. What you guys are doing in Park City is huge. You're doing what everybody's saying. We need to talk about mental health. We need to talk about anxiety. Sometimes we just need to share and be heard. Sometimes we need to have professionals come in and talk about concepts, ideas, and tools. A parent watching a child be anxious causes a parent anxiety often. So the first thing you have to do is get in touch with your own anxiety. The goal, I'm going to say this, the goal in raising children is to raise a self, not to raise a successful, smart, talented, accomplished person, but to raise a self. And a self is messy. A self is whole. A self is complete. But our children feel that idea in us that we want to raise them to be successful. And that's part of where that cultural anxiety that you're talking about. In Park City, Mary Christa said, sometimes it's about Olympic sports, right? Sometimes it's about higher education. Sometimes it's about church expectations. So we've got to shift our whole idea in this country and this society, on planet Earth, really, because it's not just our country. I've been to other countries and spoken. It's the same thing. We've got to shift our idea from raising successful, good children to raising people, selves. And to do that, we've got to heal the inner self. There are two things we know about child development. Two really important things we know. Number one, the most important contribution you can make to your child's well-being is healthy attachment. Providing a safe, secure environment and a place where they, in a way that they feel welcomed. All of them feels welcomed. That's the first piece. The second thing we know, the greatest predictor of your ability to provide a healthy attachment is how much you've made sense out of your own childhood, not how good your childhood was. So you could have a relatively good childhood and not made much sense out of it, and it wouldn't predict that you could provide this for your child. You could have a really bad childhood, traumatic childhood, and that wouldn't predict it either. It'd be how much you've made sense out of it. So you and I have talked about this for years, Mary Christa. It's always it goes back to do your work. Please do your work. Make your work, make your anxiety your project. You take care of your anxiety over here in this support group, this podcast that you're listening to, this meditation app that you're using, this support group, this community. By coming here, you take care of yourself over here. I suspect that some of you might even feel tonight a little bit fed, a little bit not alone. You have a little bit more to give when you go back to your children. So take care of you so that when you show up for them, it's not in service of you. You have resources, emotional, psychological, to give. So I think the big shift, I've said this, the virus that is on planet Earth, the psychological virus that is on planet Earth that predated COVID, that speaks to what you're talking about in our communities, is that children are supposed to take care of parents, and that's wrong. And by take care of them, I mean show up a certain way, do well, succeed, not have mental illness, not have addiction, so the parents can sleep at night. So we've got to shift in our communities this idea that children aren't supposed to be something for us. They're not supposed to love us so we feel good or appreciate us even so we feel good. We get fed somewhere else so that we show up for them and support them. Doesn't mean that you become a doormat. That's not what I'm saying. You still have to have a sense of self, and a sense of boundaries, but you show up to them as a resource, not needing, not taking from them, because you've fed yourself. You've got your belly full somewhere else.
I just would add to that, Brad, when you talk about the community and what we are intending here in Park City and Summit County. When there's a crisis, we point and we say, oh my gosh, we've got an issue with our kids and we've got to fix this issue with our kids. And we tend to point to the kids and try and fix them. And what I appreciate about your work and why I continue to invite you back and want as many people to hear this message as possible is that it's really about the adults doing the work ourselves, and that will have a radiating effect out in our family systems and with our children. And instead of pointing to the kids and saying we've got to fix our kids, it's really about turning inward to ourselves as the adults, to our systems, to our community, and doing that reflective work here. So that we shift the culture and the underlying causes that we're seeing the implications of in our kids' behavior.
Thank you, Mary Christa. I want to go back to something. There's a couple more questions, and I just want to put this out here. The first 10 people that email free book at evoketherapy.com get a free book. You can also go to our website. We also have free podcasts. And the reason I'm asking that is because somebody said, what if somebody doesn't have resources because of barriers, socioeconomic reasons? I guess my answer is you can only do what you can do, but it doesn't have to be my way. You just have to find somebody. You have to find some people somewhere. We've provided some, if you speak English, because that's the language I speak, we've provided some free resources with the podcasts, with our online services. The book, I've reduced the price to during COVID to help people that can't afford much. So there's some things that you can find. There's online resources that you can find. I don't know how to answer the question if language and resources are zero. I've got to believe that there's got to be somebody else in the world that you can talk to. It's not equal opportunity. If you have more financial means, you have more resources, but there are free resources. NAMI.org. The National Association, I don't have that up here. The National Alliance on Mental Illness, NAMI.org, is a place that you can go that can give you free resources in your local chapter. One last question. What does sit with our feelings look like? Negative thoughts and anxiety would come whenever I would just sit with my feelings. You know, I don't know if you guys have seen this when they advertise like the suicide hotlines. That would be a pretty high level of negative feelings. If you've ever seen some of the chats that they show in social media, you talk to somebody and they listen. That's what sitting with them means. Is there are support groups out there that there's refugerecovery.org that you can go to. Besides CODA, Families Anonymous, NAMI, all these that I'm saying, you sit with your feelings by allowing somebody else to sit with you in them. Even my close friends who call me when they're struggling, my task is just to listen. And what my friends will tell me after sitting and listening and talking to me is that I'm not trying to solve it and it feels better. So finding other people that you can talk to is the best way that I know to sit with your feelings. Finding somebody that doesn't get anxious to solve it or fix it. Finding somebody that welcomes it. Finding somebody where they have the capacity. Gandhi said it this way. I'll close with this quote before we say our goodbyes. Gandhi said, "A coward is incapable of exhibiting love. It is the prerogative of the brave. Projection, fusion, going home is easy, but loving another's otherness is heroic. And if we love other as other, we've heroically taken on the responsibility of our own journey." Find somebody that can sit with you. Find somebody that has the capacity to love you in non-judgment. And again, if you can't find a literal person, find some of these resources that I mentioned, search online. There are groups, there are virtual groups that can help with this process. So,
Brad, I have a quick quote and poem that I use and think about when I think about sitting with my own difficult feelings that I tend to want to push away. And it's a poem by Rumi called The Guest House. And the poem says, "This being human is a guest house. Every morning a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house empty of its furniture. Still treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whoever comes because each has been sent as a guide from beyond."
beautiful. That's beautiful. Did you see Jojo Rabbit, Mary Christa?
Not yet.
Well, there's a quote at the end. It just is a beautiful quote that you reminded me of when you were reading that by Rilke, the poet Rilke. And it says, it's just a part of a quote. It's part of a poem, actually. It says, "Let everything happen to you, beauty and terror. Just keep going. No feeling is final." So thank you, Mary Christa, for inviting me. Thank you for joining me tonight.
Thank you. It's been a pleasure and an honor. Thank you, Brad, for sharing your wisdom and your experience with our community. We're blessed to have you.
Thank you for what you're doing. It's actually my joy to be with you every time because you're inspiring. Thank you so much for what you're doing.
Thank you. And thank you to everyone who joined us tonight.
Bye-bye, everybody. Take care.